Everyone, Dr. Levine here at Unruh Spine Center, where today I want to discuss a condition that you may be dealing with that you may not know that we treat here in office. That condition is called frozen shoulder. That means that that shoulder is just not moving as well as it should be. That frozen shoulder issue could be underlying from many different conditions in which we can help not only diagnose but treat here in this office, whether that's through adjustments, shockwave therapy, or helping you with some at-home remedies. So if you think you have frozen shoulder, we have treatments in office or at home that can help you with your condition. So depending on what type of shoulder condition you're dealing with, it may warrant for you to get an adjustment in that area. These adjustments are to help increase some mobility in that joint structure, not only what's called the glenohumeral joint, which is that ball and socket joint, but also into this scapular region as well. So I'm going to demonstrate what those would look like. All right, let me just have you take a nice deep breath in, all the way out. Good. And one more, nice deep breath in, and all the way out. Good. Okay. These are two examples of some adjustments that can help, again, facilitate that motion into that shoulder. And depending on your condition, it may be warranted, and depending on your condition as well, it may not be warranted. That's why I highly recommend that you come in and we can diagnose your condition appropriately so that way you can get the correct treatment that's right for you. Again, I'm Dr. Levine from Unruh Spine Center, and if you're dealing with this condition, please call my office and make an appointment. We'll get you evaluated and figure out what your best course of care is. We'll talk again soon.